Constraint-induced movement therapy is a form of rehabilitation for the upper limb that links the two theories of neuroplasticity and cortical reorganization. CIMT was developed by Dr. Edward Taub and his team in the USA. They worked with adults recovering from stroke with hemiplegia who had limited use of their affected side in activities of daily living. Dr. Taub's team found that by restraining their stronger side and using the weaker side as much as possible, alongside specific intensive exercises, they could make significant improvements in the amount and quality of movement of the upper limb over a short period of time. These results have been repeated in numerous studies, including large multi-sited randomized controlled trials, and similar results have since been demonstrated for children and adults with other neurological conditions. The two theories underpinning CIMT are those of learnt non-use and cortical reorganization. Dr. Taub theorized that when trying to use an affected upper limb, the patient experiences negative feedback in the form of pain, a failure at the task. They learn to compensate with their unaffected side instead and begin to develop a pattern of compensatory behavior. Even when the initial central nervous system depression subsides and some motor recovery is possible, the patient continues to follow this new compensatory behavior and fails to involve their affected upper limb. Therefore, they learn not to use it. The second theory of CIMT links in with the theories of use-dependent cortical reorganization, where the representational size of body parts in the cortex is explicitly linked with the amount the body part is used. In cases of learnt non-use or developmental disregard in children, researchers have found the representation of the affected limb has decreased on the cortex. Several studies have now shown that following a full CIMT program, the affected side has increased its representation on the cortex, and this increase remains on a 6-month follow-up. This has been demonstrated in adults following stroke and in children with hemiplegia. So, CIMT does not just affect the ability and the strength of the upper limb, but it affects plasticity and reorganization in the brain. It's the combination of everything that makes this treatment so powerful and can have lasting changes for weeks, months and years after treatment.